We have all regularly read or heard of a variety of COVID-19 statistics. For a non-medical person, it can seem like an excessive bombardment of facts, frightening and simply tiring. Let's speak now to researcher and statistician Dr. Ridhwaan Suliman to help us make sense of the numbers and the graphs. Dr. Ridhwaan, good morning and thank you so much for joining us on Newzroom Afrika. Once again, it's more than 1 million cases. Sounds really scary. But 1 million cases doesn't mean that today 1 million people in South Africa have COVID-19. It means cumulatively 1 million people have had COVID-19. Is this number as scary on paper as it does sound in the psychological makeup of numbers?
Good morning, Oliver. Lovely to be with you. Indeed, it is a scary number if you think about 1 million cases, but we do need to bear in mind that this is the cumulative total over well over 9 months now. Many of those cases have fortunately recovered. Unfortunately, a percentage of those have succumbed to the virus. But if we look at the number of active cases currently, that's currently about 130,000 at the moment.
Let's take a look at some of the graphs. We're in the middle of a second wave. Do you think we've reached the peak of our second wave, or are we yet to peak?
No, we haven't quite reached the peak of the second wave, at least on a national level. The reason I say this is because we can see that the infection is spreading at different rates in the different provinces. From the different measures, it looks like Eastern Cape has passed the peak of its second wave. However, Western Cape, KwaZulu-Natal, Gauteng are all increasing quite rapidly. And those are some of the most populous provinces in the country. So we'll see the numbers nationally still increase. And then some of the other provinces are still starting to show an increase the second time around just now.
We just showed a graph of a line graph, at least, of the different provinces shooting up, with the Eastern Cape, of course, turning down, looking as though, as you say, that they have, surpassed their peak. Those spikes look sharper than the first time around, at least for the Western Cape, Gauteng, and the Eastern Cape, as well as KZN. Am I correct in reading this as a sharper increase to the top than the first wave?
Yes, I believe so. I think the increase this time around has been quite rapid, and it has been spreading really fast in the Western Cape. And we see that if we look at the confirmed cases in Western Cape, and it's picking up really quickly in KwaZulu-Natal and Gauteng too. If we look at some of the numbers, at the moment, KwaZulu-Natal and Gauteng, if you compare the cases currently compared to a week ago, they've increased by 70%. And that equates to a doubling time, or the number of days it takes for cases to double, a doubling time of new cases of about 9 days, which is really rapid.
Do you have an indication, at least in the provinces you just mentioned, Gauteng, KZN, and the Western Cape, that have a doubling time that's faster than the first time around? Do you have an indication of the concentration of people who have tested positive for COVID-19? So is it 1 in 1,000, 1 in 10,000, 1 in 20,000? Where are we sitting?
So for the Western Cape, we currently, this is done by a measure called the incident risk, and that's the number of new cases per 100,000 people. For the Western Cape, that number is currently 48 per 100,000, and that of note is double what the Western Cape saw at the peak of the first wave. For KwaZulu-Natal, this number is currently 32 new cases per day per 100,000 people. And for Gauteng, it's currently 17 per 100,000 people.
During the first wave of COVID-19, we were told that we need to test more, and then we did, and then we saw the numbers go up. When the numbers started going down, a lot of people blamed the government for not testing enough, and they said that the cases reducing is not a true reflection of reality because we're not testing enough. If we test more, the numbers will remain high. Is that the case around this time? You have a graph of the number of tests done per day versus the number of new cases per day versus hospital admissions per day in different provinces. Is there a correlation between the amount of tests we do per day versus the amount of new cases we have per day, and inclusive to that, the amount of new deaths as well as hospital admissions per day?
Look, testing is one of the key tools that we use to combat the virus. It can be used proactively to get ahead of the curve if you're testing widely enough. And it allows you to understand how widespread the infection is. And together with quick turnaround times, as well as an efficient contact tracking and tracing system, one can use this as an efficient tool to understand where the virus is and to get ahead of the curve. To be quite honest, throughout the epidemic in South Africa, we've not been testing widely enough, and the testing has not kept up with the scale of the outbreak. And one can confirm this by looking at a measure called the test positivity rate, which is a number of new cases as a percentage of new tests. That positivity rate currently, the average is over 25%, nearing 30%. Just last night, we saw that daily test positivity rate reached a record high of 32%. What it means is that we're finding a confirmed case for every 3 to 4 tests conducted. And that's really quite concerning. It means that we don't have a true idea of how widespread the infection is. And secondly, it means that the actual number of cases in reality is a lot higher than what we're currently reporting. According to the World Health Organization, we really should be keeping that test positivity rate below 5%. And we haven't seen those levels for a long time. As you can see by my graph that you put up here, most of the provinces have been well above 5% for the duration of the epidemic. To go back to your question, though, testing is related, or confirmed cases are a function of testing, but only when you're not testing widely enough. Because our test positivity rate is so high, the more we test, more cases will be found. If the test positivity rate was 1 or 2%, then the number of tests wouldn't have a strong influence on the number of confirmed cases. So the bottom line is we aren't testing widely enough. The confirmed cases that we see are an underestimate because there are many more undetected cases.
To that effect, can we use the positivity test rate we have today, 32%, to project how many people we think might have the coronavirus if we tested, say, the entire population of the country at a 32% test positivity rate? Is that a fair thing to do?
Look, I think it's not quite so easy as that. The reason being is when you have test capacity constraints and strict testing criteria, it means that you're already screening people for the virus, and most likely the number of people that do go for tests, ultimately a significant number of those will come back positive. So that does influence the test positivity rate, and this capacity constraint and the testing criteria does mean that we will have a higher test positivity rate. If we test more widely, we'll find that test positivity rate will go down. So it's not simply a case of extrapolating the current test positivity rate to get a true reflection. One needs to bear in mind the nuances to that figure.
Let's take a look at different provinces, specifically looking at hospital admissions. The Western Cape told us earlier on that they will have enough hospital beds and resources and that people should not worry. Taking a look at one of your graphs here, the Western Cape is peaking right now in hospital admissions in week 51 as compared to any other week in the last 20 weeks of COVID-19 in South Africa. Is there a correlation between hospital admissions as well as the amount of beds available in hospitals? So do more people fall severely ill if they do not have hospital space?
So I don't have, or at least the number of available beds, that's not publicly available, so I can't comment on that. What I can say by that particular graph there is that the number of new admissions in the Western Cape has been increasing and increasing for a number of weeks now. The number of new admissions has surpassed the number that the Western Cape saw at the peak of the first wave. Similar to the Eastern Cape, they also surpassed the new admissions. And the number of new admissions is also following the same trend that we see in the number of new cases. So Western Cape's new cases currently is double the amount that that was recorded at the peak of the first wave. And so because cases are leading indicator, hospitalizations lag that by about 2 to 3 weeks. So it's no surprise that the number of new hospital admissions is at a high and is following the same trend that we see in cases.
Gauteng had more hospital admissions 10 weeks ago than the Western Cape. And today, the Western Cape has more hospital admissions than Gauteng. What happened in the Western Cape that didn't happen in Gauteng that led to more hospital admissions?
Well, we're still seeing an increase in hospital admissions in Gauteng. That particular figure, it's on the increase, again, following the trend that we see in cases. So it's just that the second, or a resurgence in infection started a couple of months ago in Eastern Cape, that moved to the Western Cape, and we saw then the hospital admissions following that in those provinces. We're now seeing a resurgence in KwaZulu-Natal, as well as more recently in Gauteng. And following the increase in cases, a percentage of those unfortunately do require hospitalization, and we're seeing that by an increase in the new hospital admissions in those provinces as well.
There are calls for harsher measures as far as a lockdown is concerned. In fact, quite a number of people are asking us to go back to level 5, level 4, level 3 lockdown levels because they're afraid that there aren't enough hospital beds available. They're also asking for alcohol sales to be banned once again because alcohol-related trauma are filling up wards and units. Is there a correlation between the sale of alcohol, harsher lockdown measures, and hospital admissions? Will we necessarily see a reduction in hospital admissions if those measures are taken?
I have seen some studies and some numbers that indicate that a restriction in alcohol consumption does reduce the number of trauma or emergency admissions, and so does free up some hospital capacity. I personally haven't worked with that data. But yeah, I believe there is definitely a correlation, and there has been numbers that have come out that showed that a decrease in alcohol consumption has freed up some hospital capacity. It certainly has had an effect.
What should the numbers look like, or at least what data set should turn for us to have an idea or an indication that things are getting better?
I think that the measure to look at most closely in South Africa is the test positivity rate. Because we're not testing as widely as we probably should, the number of confirmed cases is related to the number of tests. But looking at those number of tests that return positive results, or the test positivity rate, is a good measure to follow. I believe when that starts to turn, it's an indication that we may be over the worst of it. And we're seeing that in the Eastern Cape, where the cases started to decrease. We see also that the test positivity is starting to decrease as well. And of late, the number of new hospital admissions, as well as, or at least the number of new hospital admissions, is starting to slow down. So a leading indicator first is confirmed cases, which needs to be also looked at with the test positivity. And then lagging indicators are hospitalizations and death numbers.
Dr. Ridhwaan Suliman, thank you so much for your time. Really do appreciate it. And hopefully we can speak again soon.
Thank you for having me, Oliver. Lovely to chat with you.